Columbia. We're honored to be here on the territories of the Lekwungen-speaking people, the Songhees, and Esquimalt First Nations. Today is our first report since Saturday. I just wanted to, as we do, thank all of the people involved in preparing both preparing the information that we're reporting on, all the people at the BC CDC, at the health authorities, at the Ministry of Health, everyone who is involved in all of this. And with that, I want to introduce Dr. Bonnie Henry.
Thank you. Good afternoon. So we're reporting today on the last two 24-hour periods, and we'll start with through March 29th. We had a very small number of new cases reported that day, just 16, which brought us up to 900. And then in the last 24 hours, we've had an additional 70 new cases, bringing our total to 970 here in British Columbia. So that's total new cases in the last 48 hours of 86. Of those, 472 are in Vancouver Coastal Health, 323 in the Fraser Health Authority, 67 now on Vancouver Island, 94 in the Interior, and 14 in Northern Health Authority. We have at the present time 13 long-term care and assisted living facility outbreaks, all of which are in the Fraser and Vancouver Coastal Health areas. As of today, we have 106 people who are hospitalized with COVID-19, and of those, we have 60 people who are in our critical care ICU and HAU units. I think it's really important to note as well that 48% of our cases have now fully recovered, so 469 people have been released from isolation, including over 70 who were in hospital or ICU over the last few weeks. And I think that's really a testament to the importance of people being in hospital at the right time, being ventilated at the right time if they need it, and recovering from this. And I think that's an incredibly important thing for us to remember. And my hands go off to all of the care teams in our hospitals who are looking after these people. We do have 2 additional deaths, both in the Vancouver Coastal Health region, and I can confirm the coroner's office has confirmed our first death in the community as a result of COVID-19. Due to privacy considerations, however, I will not be releasing the identity of this individual or any further information on this person. I think we've talked a little bit last week. We shared a lot of the numbers, the modeling that we're looking at, the preparedness activities we've put in place here in the province of British Columbia, and we really are in a critical juncture right now in BC. And I've said this before, but the next 2 weeks, we're in our second incubation period. This is the critical time for us, and where we'll see if our hospitals, the continuing trickle, or if we're going to see dramatic increases. It's very hard to know right now, but I do think, as I said last week, that things that we were doing are making a difference. We are not through the storm yet. We have not yet reached our peak. We have more people every day who are in hospital and in our intensive care units. So we need to continue to do all we can across government, across our health system, and in our community. Every person needs to do their bit. And I know, and I'm very heartened, that most people are really taking this as seriously as we need and are supporting each other, are keeping their distance, but keeping connected in a virtual way. I want to talk again about the fact that we do have an order that prohibits gatherings of more than 50 people, but 50 is not a number that is to be taken lightly. 50, it was only a number there where we thought it was manageable to have social distancing, to ensure that that physical distancing is there. It doesn't mean that you can have 49 people at a house party. Those are the situations that cause this virus to spread, and it's going to spread to the people who are closest to us. So I need people to understand that small groups inside are a risk. Small groups and large groups outside are still a risk. We need to maintain those physical distances, particularly in the coming weeks, so that we can break those chains of transmission in our communities, in our families. In terms of our provincial readiness as well, we've got some supplies coming in. 19 of our major hospitals are now COVID-19 hospitals. They're primary sites. They're ready for this, and they're working hard to make sure that we can be prepared to care for people who have this disease, but also everybody else who needs our health system right now. On another positive note for many, a new form of learning is beginning this week in British Columbia, ensuring that not only the children of our healthcare workers, but the most vulnerable children in our communities will continue to have the support they need from our education system. So it is back to school in a virtual way for children in the province now. We want and we need our children to continue to learn and to maintain those important social connections that they get through schooling, even though they're apart. So I encourage parents really to incorporate learning into everyday activities, that you have these opportunities with your children now at home. Things like writing emails or texting or having virtual groups with your friends, using the kitchen or the garden for science experiments, and using the new online resources from our education system to help out. So this is it. This is our watershed these coming weeks. We need to be 100% committed, all of us, to doing our part to flatten that curve no matter how long it takes. And we need to double up our efforts right now, reinforce that this is our week. We need you to continue to do your part, to do our part together while we're staying apart physically. Thank you.
Thank you, Dr. Henry. I wanted to update you on a few other issues that are before us now. Firstly, of course, is to understand that we now have 19 people who passed away from COVID-19 in BC, 2 more over the weekend. And our hearts go out to everybody, every family involved, all their families and friends, all those that took care of them in what is a really and truly difficult moment. As Dr. Henry has said, we have 106 people in acute care. That's 44 in Vancouver Coastal Health, 44 in Fraser Health, 6 in Interior Health, 8 on Vancouver Island, and 4 in the Northern Health Authority. And just to put that in context, because we've been reporting on this, we currently have 4,233 vacant acute care beds as a result of the measures that have been taken across all acute care sites, across all hospital sites in BC. I apologize because I think we were going to post this number and we didn't get to it, this information, so we didn't get to it, so I'm going to read it out and we'll be posting it subsequently. There are actually 19 sites, so we talked to 17 on Friday, 17 COVID-19 hospital sites, primary sites, that were referred to in the planning documents and the modeling documents we talked about on Friday. Those sites in Fraser Health are Abbotsford Regional Hospital, Royal Columbian Hospital, and Surrey Memorial Hospital. In the interior, they're Kelowna General Hospital, Royal Inland Hospital in Kamloops, Vernon Jubilee Hospital, Penticton Regional Hospital, Kootenay Boundary Regional Hospital in Trail, and East Kootenay Regional Hospital in Cranbrook. In the Provincial Health Services Authority, of course, BC Children's and Women's Hospitals, in Vancouver Coastal Health and Providence Healthcare, Lionsgate Hospital, Richmond Hospital, St. Paul's Hospital, and Vancouver General Hospital, and on Vancouver Island, Royal Jubilee Hospital, and Nanaimo Regional General Hospital was as a secondary site, Victoria General Hospital, which is part of that. Just to say that we've designated these 19 major hospital sites across the province to deliver care to the most critically ill patients, and to maximize capacity, and this is what we spoke about when we talked about all of the models we presented and being prepared for the most pessimistic of the models. Vancouver Coastal Health is preparing, and Fraser Health, and all the health authorities will be preparing off-site treatment centers, including, and you'll start to see this over the next few days, the Vancouver Trade and Convention Center and the new tower at Royal Columbian Hospital will be 2 of those. The intention at the Vancouver Convention Centre, at the Convention Centre, will be 271 beds, and at Royal Columbian 80 beds, and there'll be more information coming on that. All the information you'll get over the next coming days, and as those sites are developed, will be the responsibility of Vancouver Coastal Health and Fraser Health, and they'll be including potentially providing tours or giving access to that. You won't see much there at this time, but those are the off-sites, so that even though we have 4,233 beds empty, we're also preparing additional beds in order to have a place for lower acuity or less ill patients to go and to be and to provide more space for COVID-19 patients potentially in our acute care hospitals. In an effort to reduce the risk of COVID-19 transmission, we are suspending paid parking for the patients, staff, and visitors at all Health Authority owned and operated sites effective April 1st until further notice. This change makes it easier for individuals to avoid touching screens and buttons at payment kiosks that may have been touched by someone previously, and also supports physical distancing measures that have been mandated by our provincial health officer. Obviously, there are different circumstances at different sites. Many healthcare workers, for example, pay off their paychecks for parking and so on, and those deductions will not occur consistent with this policy change. I just want to speak briefly about all of the efforts on PPE, which is a major question, especially masks, but other protection equipment for individuals, particularly for healthcare workers. As we've spoken in the last few days of the challenges in the global market. I wanted to acknowledge those challenges, but I want to be also very clear, particularly to healthcare workers, that we're taking significant steps to ensure they're protected and have the appropriate PPE when they need it and where they need it. Our approach is focused around preparation, not desperation. There are 2 key pieces of work that I want to update you on today to provide more perspective on the work that we're doing to ensure an adequate supply of PPE and keep our health workers safe. Despite the challenges, BC does continue to receive supply of PPE. In the last few weeks, we've received several orders from various suppliers, including N95 masks, surgical masks, gowns, eye protection, and other PPE that are critical to keeping our healthcare workers safe. The challenge is that global demand is resulting in a situation where our previous suppliers aren't able to provide the bulk, large quantity shipments that will provide us with the comfort we need to say that we no longer have to pursue other supply options. So we're working hard on all of those. That's not to say there hasn't been a success in large bulk orders. Just today, we received a shipment of 1 million surgical masks. Finally, just to say, there was a question about ambulances and the extraordinary work done by ambulance paramedics in BC. We actually have fewer calls now. You might note that there are fewer people on roads, and I presume, and we'll have to assess this over time, fewer car accidents and other things that lead to ambulance calls. So on average, the average day is about 1,540 calls, and we've been at about 1,417 calls on average in March. But we are getting a lot more calls related to influenza-like issues. And those calls, though, over the last week have stayed relatively constant. So last Sunday, March 22nd, or 8 days ago, we received, ambulance paramedics responded to 339 calls. This Sunday, it was 320 calls, which is roughly the same amount. And finally, I just want to thank all the nurses and operators at 811. Yesterday was the lowest number of drop calls that we've had since the beginning of the issues around COVID-19 in the month of March, and the average wait time at 811 calls yesterday was 1.3 minutes, which was a reflection of the extraordinary work they're doing. And so I'm just going to finish, if I may, by saying a few words in French to conclude. Aujourd'hui, nous fournissons une mise à jour de cas des 2 périodes du rapport de 24 heures, du 28 à 29 mars et du 29 mars à midi aujourd'hui. Au cours de la première période de rapport jusqu'au 28 mars 2020, nous avons eu 16 nouveaux cas pour un total de 900 cas en Colombie-Britannique. Au cours des dernières 24 heures, nous avons enregistré 70 nouveaux cas pour un total de 970 cas en Colombie-Britannique. Cela représente 86 nouveaux cas depuis notre dernier rapport samedi. Chaque régie de santé compte des patients atteints de COVID-19. 472 se trouvent à Vancouver Coastal, 323 à Fraser, 67 sur l'île de Vancouver, 94 à l'intérieur et 14 au nord. Nous sommes attristés de signaler 2 décès supplémentaires liés au COVID-19 dans la région côtière de Vancouver, entraînant un total de 19 décès liés au COVID-19 en Colombie-Britannique. 469 ou 48% des patients atteints de COVID-19 ont récupéré et n'ont plus d'exigence d'isolement. So with that, we're happy to take your questions. Thank you.
Thank you. And as a reminder for everybody on the phones, please press *1 to enter the queue. You are limited to 1 question only. Please also unmute your phones. You will not be audible until we call your name. So our first question is David Molko, CTV. Go ahead.
Dr. Sean Wormsbecker, Royal Columbian. He says in the videos the first time in his career that he's genuinely frightened. He says BC is not testing enough. More testing would make those who might be positive more likely to comply and self-isolate when he sends them home. He's worried that an unintended side effect of our testing strategy is people who are going home are then letting their guard down. What do you think?
Yeah, I actually don't agree with that. And having been on the front lines with my colleagues in public health who are actually talking to these people who are at home and who are self-isolating at home, most people are absolutely doing what we need them to do. And our testing strategy, as I have explained a few times, has changed so that we are focused. The large number of tests we're still doing, over 3,000 tests a day, we're focusing on those most likely to have this disease and those most likely to need health care or hospital care. So that is an important strategy. It's not that we're decreasing the number of tests we're doing, it's that we're focusing the testing on the people who are most likely to need the health care services. And we are still maintaining the contact tracing. We're talking with people who have this, who have mild enough illness that they're able to stay at home. And for the most part, that is working. I think we need to, and I've been saying it a number of times, we need to understand that this is now being transmitted in our communities across the province, and that is why it is so important for all of us to do our part around staying home if we're sick at all, around making sure that we self-isolate, and that does mean not going to the grocery store, not going to the drugstore, not going outside our property if we are sick ourselves. You know, I think all of us are anxious about what's going on in our health settings. The numbers that are really true, if you will, about the more severe cases are the numbers of people that we're seeing in our hospitals and the rate that people are coming into the hospital. And as you know, much of our outbreak, particularly in Vancouver and the Lower Mainland, has been focused on long-term care homes. So focusing our attention on making sure we're doing everything we can in those settings is incredibly important. But it's challenging for all of us to not know what's coming in the future. And particularly when we hear about shortages and we watch what's going on in the world around us, you know, we don't know what's going to happen in the next week to 2 weeks. We can only continue to watch, continue to prepare, continue to make sure that we're doing everything we can, and to ensure that the rest of our community is doing their part too.
Next is Rob Shaw, Vancouver Sun.
Oh, hi, Minister. I was wondering, could you just tell us what kind of patients are being moved out of hospital now to free up space? What kind of people are going to the Vancouver Convention Center? I know you say lower acuity, but could you put that in kind of more understandable terms, what type of people we're talking about, what type of illnesses? And then you had mentioned the modeling on Friday for a Northern Italy hospitalization type of scenario where other people would be moved out hospitals. So who's being moved out now, and then who would conceivably be moved out in that more serious worst case scenario?
Yeah, so I'll start. Right now, people who are moving out of the hospital are people who are waiting for placement in an alternate level of care. So many people are being moved temporarily into long-term care homes, for example. People who may have been in acute care bed for some time waiting for a placement. So instead of having their permanent placement, they're being moved into spaces in long-term care. That's the primary area. We also are ensuring that people who've had minor surgeries or had other surgeries prior to the routine scheduled surgery stopping are being discharged home as soon as possible and making sure that they have the care that they need in the community. We are not putting anybody into the Vancouver Convention Centre this week. That is part of the strategy, as we talked about. If we start to see dramatic increases in numbers of people in hospital for COVID-19, and we need to cohort them so that they are all in the area where they can receive the critical care that's needed, then we would look at moving people who had other illnesses, so people who were recovering from their heart attacks, recovering from trauma or other injuries that brought them into the hospital. If they didn't need to be accessed that close to the potential for critical care, we would potentially move them into an off-site facility like the convention center, should we reach that point. So we're not expecting anybody in the near term to be there. Yeah.
And just, Rob, just to put it in context, our current occupancy is about 60.6%. Not about 60.60%, it's 60.6%. And our current critical care bed occupancy is 53.7%. The main group of people that we're not taking into hospital right now are elective surgeries, and you see the thousands of surgeries that have been canceled so far, which obviously creates significant space. In addition to that, alternate level of care patients have been moved out of the hospital. So the purpose of these alternate sites is to prepare for all scenarios. Right now, as we said in the briefing, there are 4,233 empty hospital beds. So this is creating even more capacity than that. And to do that, you have to prepare in advance. You can't decide 2 days from now you need a temporary hospital and put that together. So in all of the health authorities, we're preparing those sites. And at the Trade and Convention Center, I think I gave you the numbers. I'm just trying to recall. It was in the neighborhood of 200 additional beds, and that's a big enough site that you can in fact set up two separate hospitals treating two different types of people. So with 4,000 plus empty beds, we're not moving anyone there soon, but this shows our determination to be prepared for people, and also to ensure that people who may have less serious illness or recovering from treatment other than COVID-19 can continue to be separated from people who are dealing with COVID-19 in hospital, and that's going to be true in all the health authorities. The Royal Columbian site, as you know, is phase one of a major hospital renewal there, so we were about to open that site for its intended purpose, which is related to mental health and addiction programs, so we will be holding off that opening and using that site for this purpose, or until it's clear we won't need it in future.
Next question, Ethan Sawyer, CBC.
Hi there. Yeah, my question is just pertaining to Dr. Henry's comment earlier mentioning the coroner's office has confirmed our first death in the community as a result of COVID-19. Just wondering if you can define a death in the community. Is it just a death outside of a hospital or a healthcare center?
That's correct. So this was a person who died in their home, and it was as a result of COVID-19.
Next question, Cindy Harnett, Times Colonist.
Oh, hi, Dr. Henry and Minister. There's several businesses on Vancouver Island that are putting their creative forces together in one instance, making face shields out of 3D printers. You talked about getting 1 million masks in. Are these kind of endeavors something that you support in that you could run out of these supplies?
Yeah, face shields are actually a very important part of the personal protective equipment that we use for a droplet transmitted infection like COVID-19. So you will have seen pictures of people wearing the face shields over with, or goggles with a mask or a respirator. And so yes, there's a lot of really innovative people out there who we've been connecting with, and we have a whole group at the ministry who are validating each individual donation or offer of help, and there's a variety of things. So 3D printing of visors is something that I know they're looking at, and looking at, you know, what types of volumes we could do, because it is a very important critical piece to protect healthcare workers.
Fran Yenor, the GOAT.
Oh, hi. My question is about the order restricting healthcare workers to one long-term care facility. You're probably aware most of these people work in several facilities out of economic necessity. I'm wondering, I couldn't see for sure in reading the order, how are you ensuring that they aren't financially penalized by this? And also, just this morning we got word that of a long-term care facility that put out a call for volunteers. Wondering how we're making sure that there's enough qualified staff in each facility also.
Yeah, that's been occupying a good deal of our team's time over the last couple of weeks. Once we recognized how important it was, and as you know, we've had a number of outbreaks, particularly two quite large ones in Vancouver Coastal Health at Lynn Valley and at Harrow Park. So the challenge has been to try and track healthcare workers, and as we know, many of them work not only across facilities but also in acute care and long-term care. So yes, we've been working with the unions, with HEABC, and the bottom line is everybody will be employed by the ministry at a specific rate, so that they will not be penalized, and that they will all be at the same rate, and there will be a central assigning body that works essentially under my direction, under the order, to ensure that each facility has sufficient staff. So it is a complex thing. We have many different types of contracts and employees, and we need to make sure that it's done in a way that doesn't disadvantage anybody, and that it doesn't allow people to pick the place that pays a higher wage, for example. So this is an extraordinary time, and this is a very important measure. So for the time being, everybody will be at the same wage and will be offered full-time employment, so that we can make sure we have the adequate staffing for every facility. As you can tell from saying that, this means a lot of different contracts and negotiations and things that have been worked on, and I just can't thank enough our unions and the HEABC and our team at the ministry, who have been working day and night on this to make sure that we do the best that we can do for our healthcare workers who work in these facilities, and to be able to best protect our seniors and elders in the facilities. So it is something that will be rolled out over time, focusing, of course, on where the need is most, which is the Lower Mainland, and that's started already. The request for assistance is around, and I know the number of, I think it's up to 11 now, that we have facilities where we have outbreaks. That's a very challenging time, because we make sure that we put restrictions on what staff can do, on what visitors can come in, on what residents can do, and it is an exhausting thing to be managing an outbreak and to be working in those facilities. So I know there has been requests for assistance from others to come in and supplement the staffing in some of those facilities, and I'm also very grateful for the number of nurses and care aides and others, healthcare workers in those facilities, for stepping up and helping out during this period.
Next question comes from Tom Zatark, Surrey Now Leader. Go ahead.
Well, good afternoon. We have a rather large seniors complex here in Surrey called Elam Village, and the Fraser Health Authority learned on Thursday night that a healthcare worker working in long-term care there has the COVID virus. Have any more infections been discovered there at Elam? Do you know?
I don't believe so. The latest I had on that was it was still remained at the individuals that we were the one individual that was a staff person there. And, they did find out about this very early. And as I said, these very aggressive, they have now SWAT teams that go in to a facility to make sure we have the infection control pieces we need, the personal protective equipment, that everything is done as rapidly as possible. And it's been very effective. I mean, we're not out of the woods by any means, but as far as I know, that is stabilized and we're waiting. The challenge with this virus, of course, is that the incubation period can be up to 14 days. And we know that there are some people who have been exposed in that facility, and it's a matter of keeping them isolated, monitoring them, and waiting to see what's going to happen over the next few days. So we're not out of the woods there yet, but I know they have put in a lot of the important measures to try and, if people develop the illness, that it won't be spread to a next generation.
Next is Richard Zussman, Global News.
Dr. Henry, I'm just wondering what your thoughts are on the FDA's emergency use authorization of hydroxychloroquine in the treatment of COVID-19. Do you think Health Canada should follow suit? And what have been the early indication of the clinical trials so far here?
Yeah, so hydroxychloroquine is a drug that is approved for use in Canada for malaria. It's also used as a drug to help treat lupus and some types of arthritis, rheumatoid arthritis. So there's no need for a new for Health Canada to do anything. It is a medication that is available in Canada, and the jury is still out on whether it has benefit or not. And so we are watching very carefully. I think I mentioned on Saturday that it has been used in some limited protocols in our long-term care facility outbreaks, but we don't know yet. We don't have enough data and time yet to know whether it's been effective, both as a preventive medicine. So if we give it to somebody who's been exposed, does that decrease their risk of developing the disease, or does it work to treat the disease? And there is a big, mentioned that as well, it's called Solidarity. There's a large studies being done around the world, and we're part of it here in BC with a number of our colleagues from UBC and BC CDC who have these protocols, and we unfortunately don't know the answer to that question yet.
Okay, Andrea Wu, Global Mail.
Oh, hi. Just following up on the earlier question about long-term care homes. As you mentioned, these facilities often rely on a complicated network of contracts and subcontracts for care and feeding aids, and they often work at multiple facilities. Will there be a review of contracting and subcontracting at long-term care homes when this is over?
Right now, all of those contracts, we've essentially said, for the purpose of this pandemic, we're going to hire everybody, as many as we can, full-time by the province, to be assigned through a central body. So that is for the next 6 months. Whether there'll be a review at the end of that, I personally hope so.
It certainly won't be the only issue reviewed, but it'll be one of the issues reviewed, yes.
Next is Dirk Meisner, Canadian Press.
Hi, Dr. Henry. You commented earlier about the doctor from Royal Columbian. I'm wondering if you have any comments to make on the former medical health officer from the North who, in an open letter, says the northern communities need more information about COVID patients there. And also, he says you should shut down the work camps up there.
Yes, I know Dr. Bowering quite well, and I think it's unfortunate that he is not as connected with the Northern Health medical health officers as he was in the past. But the Northern Health has been doing an amazing job, and the medical health officers are aware of every case in Northern Health. And like the rest of the province, every case is investigated. All the contacts are notified, and they're following the same procedures as we are everywhere else. So people in those communities who are at risk know who they are, and they have been isolated, they have been quarantined, people have been treated in hospital there, and the clinical teams in Northern Health are doing an amazing job supporting people as well. I think that the important thing, as we have everywhere, is that every community needs to realize that we are not immune. There is no community that is immune to this virus. We travel a lot, whether we realize it or not. We come back and forth with essential services that we need in many communities across the north, across the territories, and across the province. So we know that there's been people who've traveled who've been to many of the northern communities. We also know that many of our Indigenous communities are putting in place measures to try and protect their elders and to make sure that they have plans in place to be able to respond should we have any introductions into those communities. So right now, the measures that we need to do in the Lower Mainland, we need to do in Terrace, in Lake Mabine, are all the same. We need to physically distance from each other, and we need to make sure that if we're sick at all, that we're staying away. In terms of the industrial camps, I mean, that is something that we've been working with, Northern Health in particular, but across the board in the north. Many, if not all of them, have gone to a very reduced staff. For various reasons. We don't want as many people coming in and out of the community. They've done things like extending the length of time that people are there, going to safety staff only. I think it's important to recognize you can't just abandon a large mine or industrial site. That's not safe. It's not safe for the community or for the environment as well. So Northern Health has been very active working with the industrial camps in the north to reduce the risks in those camps and to make sure that that they're scaling back appropriately to be able to put in place the measures that we have required and under our PHO order in those facilities to reduce the risk to the people there and also to the communities around those camps.
Next question comes from Eric Chung, Fairchild.
Yes, Dr. Henry, you talked about the first case of COVID-19 related death in the community. So are you guys following up or tracking those people who is close contact with the man died in his residence?
Yes, absolutely. The close contacts are in isolation, and many of them, of course, are family members, but the investigation was quite detailed, and anybody who had contact with the individual was notified.
Next question comes from Keith Baldry, Global News.
I know the hospitalization numbers are up significantly. You expressed some concern about that. At the earlier briefing, you gave us sort of an idea of who's in hospital right now. Is it still primarily older people, or are we seeing a shift towards any other demographic and anything?
It is still mostly older people, people in over 65, although we do have a blip of younger people who are ill with this, many of them healthcare workers, as we know. So, but most people in hospital, and certainly all of our deaths, continue to be in older people. We've had very few. We've only had a small number, less than 5% of our cases are in people under the age of 19, and there was only one short hospitalization in a child that is no longer in hospital at the moment.
Okay, next question comes from Ashley Legasic from CFJC. Ashley? No. Okay.
Hello.
Oh, hi. Go ahead.
Hi, sorry, I was speaking. I wasn't on mute. Hi, Dr. Henry. We have heard from the Interior Health Authority about a seniors living community in Kamloops, Riverbend Manor, where there may have been an exposure to COVID-19. Do you know of any confirmed cases at that property?
You know, I don't know the details about that property. No, we report outbreaks when they're in a facility. So that's we have a protocol for that we've had for many years. So if it's a long-term care home or a acute care hospital or one of the facilities that we run, so I may not be aware of the details if it's in a community setting.
So we have time for one more question, but before we get to that, for any reporters that didn't get to ask a question today, there will be a statement released later this afternoon with all the information covered in today's media veil. For recommendations on protecting families and communities from COVID-19, visit the bccdc.ca website. For non-medical questions about the province's COVID-19 response, please visit gov.bc.ca/COVID-19. Our last question comes from Pierre Chauvin, CBC Radio Canada.
Hi there. Yes, it's just a question in French. I'm wondering if Dr. Henry could speak of the fact of all the people who live in Victoria and on the island in vans and who rely on public places to live, and how those people would deal with an infection.
Je pense en général que les mêmes règles s'appliquent, n'est-ce pas? Et il faut que tout le monde, où qu'il habite, où qu'il soit, suive les conseils du Dr. Henry. Ça, c'est possible dans des cas où des gens sont vulnérables pour quelque raison que ce soit, que nous nous efforçons d'établir et de soutien pour ces gens-là. Donc, dans ces cas, et comme d'autres, un tas d'autres, y compris dans le monde agricole, etc., il faut travailler sur chaque cas et de considérer chaque cas comme important, et c'est ce qu'on fait. Just wanted to say in conclusion that what Dr. Henry said at the beginning is what really applies for me and I think for everyone else, which is that we have to be into this now 100%. The next 2 weeks are absolutely critical for us. And daily reports are important for us, and they'll be continuing coming to provide information. But I have been so impressed this weekend to see how many people have been listening to what Dr. Henry has been saying. But this next 2 weeks is a critical 2 weeks. We have to be 100% all in. Every one of us has to be committed to it. And we can see, the good news is that we can see when that happens, that not just the healthcare system is breaking the links of transmission, but all of you are. So I wanted to express our thanks to everyone out there who is doing their part in this, and ask anyone who may not be well, we need you. We need 100% of all of you to do what we need to do in the next 2 weeks. Merci beaucoup. À la prochaine fois. Thank you. We'll see you next time.
Thank you.
Do you want to finish on? No.
Let me tell you about